Hey guys, thanks for tuning in with me on this presentation of a case on post-treatment Lyme disease syndrome. We're going to get started. This is a case about dysautonomia that started with her Lyme diagnosis and continued after treatment. We're going to focus on holistic and herbal therapies to talk about how I helped her improve her symptoms. Okay, so here we have a 43-year-old patient that presented as a new patient in my practice, had some complaints of fatigue, diffuse joint pain, and racing heart for 6 months. She does run an outdoor preschool or a forest school where she's frequently in the woods and doing a lot of hiking with children. However, she doesn't recall a rash or tick bite, but she does come in contact with ticks a lot. Her last PCP had referred her to a cardiologist. They diagnosed her with basically benign tachycardia. So we ordered some diagnostics. We did a TSH, free T4, free T3. We did iron studies with a CBC. We did a CMP mostly for the electrolyte studies, and we added a magnesium. And then we did do Upstate's two-tier ELISA testing system for Lyme. And then we did a VLS E1 peptide C10. And some of these labs had already been done by her last PCP and been unremarkable, but I went ahead and repeated them. And we also did an EKG in the office, which was pretty unremarkable as well. So you can take a peek at the lab results that we got back on her. Her thyroid panel was not much to write home about. Same with her iron and ferritin. Not my favorite ferritin ever, but for a menstruating female, pretty par for the course. Electrolytes looked great. And when we did the first year of the ELISA, it came back equivocal. So that reflects to the IgG, IgM at Upstate. Her IgG was positive and her IgM was equivocal. We did not have a Western blot because we did not send her for one. Upstate doesn't do Western blots anymore. So this is where our testing in this particular patient ended for Lyme, but also her VLS-E1 was positive as well, supporting that diagnosis. So we started a 28-day course of doxycycline, and because she is one of my more holistic leaning patients, we also started cryptolepis 30 drops 3 times a day and bicol skullcap 15 drops 3 times a day. We didn't do anything else at this time. We just planned to follow up in a couple months and see how things were going. The other thing that we did do with that visit, however, was we took a look at her supplement list and just reviewed it for safety. I had her stop any immunostimulating herbal therapies, and she was a person who frequently took both turkey tail mushroom and elderberry daily during kind of the cold flu COVID season. So I had her stop those two supplements and advised her kind of on my list of other things to not take, including maitake mushroom. So when I saw her at her 2-month follow-up, a lot of her pain and fatigue had resolved, but she hadn't found any improvement in her heart rate. In fact, she told me that she was also having lightheadedness, and she thinks that that was also going on for the past 6 months as well. It just hadn't kind of been at the top of her consciousness, but she did report about 4 presyncopal episodes in that 6 to 8 month period since she started noticing that all these symptoms were occurring. Her Apple Watch range that had been tracking for the past 4 weeks ranged her between 40 and 150. So at this point, I just did some basic orthostatic heart rate measurements in the office and found that she ranged from kind of the 60s all the way up to the high 100s, depending on her position. So we decided to start treating for some dysautonomia related to her Lyme diagnosis. At this point, I did not refer her for a tilt table test or to neurology or back to cardiology, since the findings that we had found during her orthostatics and her clinical symptoms were not to the point where I thought that it would warrant a tilt table test, but definitely affecting her functional status a little bit. So we decided to treat it just as dysautonomia. So in that regard, because she was interested in starting botanicals, we decided to do a dual therapy approach. We decided on doing medications and herbs together because she was having presyncopal episodes, and we needed something that was going to start working fairly quickly to keep her safe. So we decided to start propranolol 10 milligrams 3 times a day alongside an herbal blend of hawthorn, motherwort, wood betony, and skullcap. So hawthorn is an overall cardiac tonic, helps strengthen the heart muscle and normalize heart rate. Motherwort is specifically indicated for tachycardia syndromes. Wood betony affects the vagus nerve and helps to promote vagus nerve regulation, and skullcap is a nervous system relaxant. So we started this blend at 30 drops 3 times a day, and then we also discussed monitoring for symptoms of hypotension pretty closely because Hawthorne can have some interactions with beta blockers where it can potentiate their effects. So we talked about monitoring for symptoms of that. The other thing that we did was we added 15 drops 3 times a day of licorice extract for blood pressure support. Her blood pressure was running like low 100s, 110s, over 60s. So I felt this was pretty safe to do. And licorice can really be a great support for folks with dysautonomia to help with that presyncopine hypotension. However, licorice is definitely not safe to start for people with hypertension. So we talked about monitoring for signs and symptoms of hypertension and hypotension. We also talked about common sense functional approaches to dysautonomia symptoms, when and how to use compression stockings, how to manage triggers, fluid electrolyte supplementation, and increasing her protein and iron intake just for that foundational reserve. And when we followed up at another 2 months, her heart rate range on her Apple Watch had shrunk. So she was around 60 to 130, and she had only had one further presyncopal episode. So we decided that we would leave the herbal therapies the way that they were. I didn't want to increase too much because she was also on the beta blocker, but we did decide that now would be a good time to start weaning that beta blocker off a little bit. So we decided to just use the propranolol PRN as needed with guidelines for when to use it instead of using it daily standing. So we got thrown a little bit of an interesting curveball at our next follow-up. She had some increasing life stressors that had happened since I last seen her. And she'd had some increased anxiety, which had been triggering some heart rate spikes more often than they had in the past. So we decided to add Cymbalta 30 milligrams, and we kept on the PRN propranolol as needed, so that she had that available for both kind of feelings of panic and heart rate fluctuations. And we didn't make any increases to the herbal therapy at this point because of the propranolol. So, at our most recent 3 month follow up, she was doing really well. Her anxiety symptoms had been improving on the Cymbalta. Her Apple Watch had ranged her between 60 to 95, and she'd only been using the propranolol for breakthrough anxiety and heart rate support, which was about twice weekly, which was a big improvement from her using it multiple times a day before. And wasn't really having any significant presyncopal episodes. So we decided, since we were kind of, her goal had become to get rid of the propranolol as much as possible, we decided to go up on the herbal therapies from there. So at this point, I'm seeing her again in another month or so. So we'll kind of see how things are going from there. But I anticipate that she'll be continuing to do well on herbal therapy and that she will hopefully be kind of off meds completely, which was her goal. And speaking of which, we always follow, big takeaway is always following the patient's lead when it's safe to do so, as far as whether they want medication, herbal therapy, or a combination of both. I find that dual therapy often works best, but as far as starting herbs and deciding to back off and start meds, always kind of follow the patient's lead on that. And then, of course, just to reiterate again, Hawthorne and beta blockers carry risk for hypotension and bradycardia when used together. So you might find that if you start one, you need to decrease the other bit a little bit. And then, as far as licorice goes, DGL, or diglycerated licorice, is the only form of licorice that's safe with hypertensive patients that has the alkaloids taken out that can interfere with hypertension, with blood pressure, excuse me. And the last thing that I'll mention is that herbal medicine is really slow, and it's really, really slow. It takes months and months for us to really see what herbs are going to do. As you can see, this case study was over a period of several months, and the changes happened pretty slowly for her, and we still weren't back to her baseline. So oftentimes medications work well in the short term while the herbal therapies get up and going, and can also work in conjunction with each other long term to get the patients feeling as good as they possibly can. And then I also generally avoid immune stimulating herbs in post-treatment Lyme disease syndrome, which we already discussed. Thank you so much for letting me share this case with you. And if you have any questions, feel free to reach out to me. Okay, take care.